Hey, good morning and welcome back in. It is time now to Ask the Pet Doctor. Today, we are focusing on efforts to discover any health issues with, I'm sorry y'all, I'm laughing because that's what's going on.
He did a little exploring on his
Well,
own.
Mr. Peabody over there visiting Fred Hunter, and who can blame him, you know? All right, welcome in to both of you. Dr. Jerome Williams, our regular guest here from Red Mountain Animal Clinic, and Katie Locke, Dr. Katie Locke, she has a mobile veterinarian specialist. Good morning to both of you.
Morning. Good
All three of you. All right, good to see you. So you said just this week you recommended her services to 2 different patients?
Yes, yes.
What was going on?
Well, one had enlarged lymph nodes. We wanted to find the extent of the expanse of those lymph node invasions. So with the ultrasound, she's able to determine that. And
So you don't have that in your office, is why you need to refer
now,
that.
there are many doctors that do ultrasound, but I do not.
So how does the mobile unit work?
So a lot of times, just like Dr. Williams said, a lot of our general practitioners may have ultrasound units, but they're not maybe as detailed as the units that we carry, especially in the specialty world. And so we're able to do a full abdominal ultrasound.
So do you bring them to their clinic?
We do, yep. We roll it in, we have a nice stand, a big unit, and we're able to do really any size dog and any size cat. Look at all of their major organs and then lots of detail.
What are we looking at here?
So this is a spleen, and unfortunately this is not a very happy spleen, and this is a case where a dog, we were able to confirm that they did have underlying cancer, whereas that's more of a normal spleen. And so we're able to look at that very non-invasively, and then we're able to actually take samples of those organs if they are abnormal and be able to confirm that diagnosis without having to go to surgery, and then be able to start medication pretty immediately.
How do they respond to medication when it's something like that?
So typically it all depends on the animal. Every animal responds differently, but we're able to stage them and give owners a really good, ideal prognosis and expectation, and put them on a treatment course for that.
So because our animals, our pets, can't tell us when something's going on, is it oftentimes it's kind of things have gone on a little longer than maybe you would want them to because they start showing some symptoms?
Exactly. So like Dr. Williams, the cases that we did this week, they've already done blood work, they've already had a physical exam, they've already done x-rays, and so we're leading up to the next step, which is an ultrasound. And that really helps us deduce, okay, we know the diagnosis now from the ultrasound, or we can now move on to further diagnosis or diagnostics like surgery or endoscopy to further get a diagnosis.
Doctor, do you do ultrasound on horses as well?
I don't, just dogs and cats.
That would be an interesting, that would be a large ultrasound.
They're always interesting in large animals.
I'm sure there are large animal veterinarians who do that. But so I guess as we wrap up for our viewers who, what can you look for in your animal that you may say, we need to go have this checked?
Yeah, absolutely. So sometimes the acute setting, we do use ultrasound, stuff like foreign bodies, especially around Christmas. Our pets tend to eat naughty things, so we can find those on ultrasound. But it's usually our chronic patients. They've been vomiting, they're having diarrhea, it's just waxing and waning, and a lot of times that's the trigger for us to go ahead and do an ultrasound.
And our x-rays have limitations that ultrasound can go beyond.
Okay.
Right.
All right, well, thank you both so much.
Absolutely.
Thank you, Dr. Katie Locke, and of course, Dr. Jerome Williams. Mr.